Okay, hi everybody. We're going to start talking about the anxiety disorders now. So, this is probably the part that you're expecting when you take an abnormal psychology class. So, today we're going to start with generalized anxiety disorder. It's only one of the disorders, and there are many anxiety disorders, but this is the one that's probably the most kind of free floating, broad stroke type of anxiety. Okay. Um, so, this is kind of an overview about, I think there's somebody in the waiting room. Hold on. Yeah. I don't know why my participant group is. All right. Um, so this is a list of the anxiety disorders that are probably most common. We're probably going to cover them all except selective mutism and separation anxiety disorder. Those are the ones that occur primarily in childhood. And there's a course on it's an advanced course, but there's a course on um, ab, abnormal psych in children and adolescents that you could take to cover those. So the ones that we're going to cover in here are generalized anxiety disorder, panic disorder, agoraphobia, social anxiety disorder, and specific phobias. So generalized anxiety is generalized anxiety disorder is kind of chronic worry, and it's worry about just about everything. Um, it's uncontrollable. So there are many people who worry a lot, but if they need to focus on something else, they can put it aside. They can stop. They can convince themselves to focus on something else, or if they're doing something fun or with a friend, they can stop when they need to. If they need to study or sleep, they can stop and go to sleep or study. But in generalized anxiety disorder, it's uncontrollable. So it's excessive and uncontrollable. And there's apprehension about everything. So a lot of people have the experience that they're kind of anticipating things. So there's kind of an anticipatory dread, like the exam's going to be horrible. I'm going to freeze. I'm going to forget everything I studied, and I'm going to fail. And that's kind of an anticipatory dread. And then some people find out that when they actually do things, it's never quite, or it's usually not quite the catastrophe they were expecting, right? Um, but that doesn't tend to reassure people with generalized anxiety disorder. They don't kind of learn from that and calm down in the future. So they'll continue to worry about school. If they have a job, they'll worry about work. They'll worry about their relationships, even if their relationships are going really well. Health, just about everything. It's not circumscribed to one area. Now, it has to persist for 6 months or more. Can you imagine why it has to persist? Why would it have to last that long to be diagnosed?
Because we all naturally go through anxiety at some point.
Yeah. Who said that? Sorry, you're on the other. Is that Christopher? Okay. Yeah, because it's natural to go through periods of high anxiety. So think about, your first semester away at college, or having a child, or um, anything that's kind of a scary transition, anything that's a life stressor, that can cause a lot of anxiety that's not necessarily pinpointed to just one thing. A lot of people who are anxious about something, it's not it's not immediately obvious to them what's causing the overall anxiety. Okay, and somebody's saying a lot of doctors like to keep you from going on medicine until needed to see if life changes can help before medication. Yeah, that's true. Um, yeah, I remember when I went to grad school, I don't know if I mentioned this already, but I had a tough time in the beginning of grad school, and my dad was like, I wouldn't diagnose you with anything because it's normal to be really stressed out when you go to grad school, right? So he considered that like a normal part of transitioning, right? Um, but if it lasts for more than 6 months, that's kind of a sign that there's something more than just a normal kind of stressful transition going on, right? Um, it's also accompanied by some physical symptoms, and it kind of makes sense, for physical symptoms to accompany this kind of thing. Have you ever noticed that when you're stressed out, you're kind of tensed up, right? You ever think about, have you ever almost gotten into a car accident or gotten into a car accident and you're kind of like, you're you're all stressed. And actually, my ex-husband was a doctor and he worked in the ER sometimes. And someone came in who, oh, there's my cat. Hi, Dados. Um, I have two others that, oh, well, I think one's asleep on my bed. But anyway, somebody had bent the steering wheel. There were two like 18 wheelers kind of um, coming on her at the same time, and she thought she was going to be crushed. She went like this and actually bent the steering wheel. So people get pretty bad muscle tension when they're super stressed out, right? Um, so that can happen. And so what happens is people get really sore. You can get really fatigued from that, from being like a constant state of hypervigilance, like scanning the horizon for possible catastrophe, right? Being constantly on edge. It gets tiring. And in terms of irritability, kind of snapping at people, I kind of think of, you see those videos of rescuing an animal, like a little dog who got dumped or something. And if they're injured, they kind of lash out, right? But it's not because they're jerks, right? It's not because they're mean dogs. It's because they're stressed, right? They're in fear. They have a lot of anxiety and they're in pain. And that's why people with anxiety get irritable and snap at people, right? Concentration difficulties. If you're constantly worried about absolutely everything, it's going to be hard to focus on what the issue at hand is, right? If people have, you know, worry that they can't worry that they can't control, then they can't think about what they need to think about. And it also causes sleep disturbance. And sometimes I think the tension, like the muscle tension, is related to that because when you fall asleep, your largest muscle groups have to relax. So when it's hard to let those relax, it's hard to fall asleep. The other thing is people who excessively worry think, how am I going to do tomorrow? I have this, this, and this, right? So they're laying there thinking of all the things they have to do the next day, or worrying if they're going to be able to wake up in time, if they're going to wake up on time, if they're going to be late, if they're going to be prepared, right? And then they start worrying about whether they're going to fall asleep. and if they're going to get enough sleep, right? And so thinking about falling asleep is pretty much incompatible with falling asleep, right? It's okay, sweetie. Um, Dados is a little anxious. Dados may have generalized anxiety disorder. I think it's separation anxiety disorder from my husband, actually. Um, but anyway, so yeah, it can really interfere with your sleep because someone's worried about things and that's all going through their head. They're worrying about sleep and they're so tense that it's really hard to relax, right? And so we've all probably experienced anxiety, right? Like the morning of an exam, uh, right before an interview or a tryout for something or an audition or before asking someone out, right? And something like that usually causes anxiety. But what are the things that make this a disorder and not just normal worry?
Like when it affects your daily functioning or, how you can, like if you can't do things or you can't go to school or things like that.
Yeah, so when it starts to cause dysfunction, right? And so that means like occupational. So for you guys, it's school, or if you have a part time job, if it messes with your job or school, you know what I mean? If you're so anxious about things that you procrastinate, anybody guilty of that? Like you are so anxious about something that you can't start doing it because it like fills you with panic to look at it even. Does anybody have that? I think that's pretty common, isn't it? I used to do that with my taxes. I was like, no, I'm gonna owe when I was like a poor graduate student and they didn't take taxes out of my tiny like stipend that I got. I was like, no, I can't do them, so I'd wait until like April 14th, right? Sometimes I'd file for an extension. It's like it's denial and procrastination because it's just too distressing, right? That's a really common thing. Okay, so and that can affect your functioning. What else? Some things we're going to talk about over and over again in determining what's just a basic problem that a lot of people have versus something that requires a diagnosis. That an official diagnosis are severity and duration. So one of the things that makes this more severe is that it affects your work life and your relationships, right? Um, and what about duration?
Isn't that like how long it lasts?
Yeah. So how long does it have to last?
6 months.
Yeah, at least 6 months, right? And also, like, it's excessive and it pervades everything, right? So it's also like how selective versus how pervasive it is. Pervasive means it impacts everything. Okay. All right. So remember that when we're deciding whether something's just a regular problem that a lot of people have versus a disorder, severity and duration are two of the things that you're going to consider. And then there's dysfunction, like Rosie was saying. Dysfunction, and that's usually social and occupational, which for you guys is your education. There's deviance, meaning it's not the norm for your culture, right? So, how much time do you think it's normal for college students like you guys to be worrying about your classes in school? Do you spend a lot of time worrying about it? How many of you spend a lot of time outside class worrying about class? Raise your hand. Okay, so it's somewhat normative for college students to spend a decent amount of time worrying about it. When would it become excessive? When would you say this person might have GAD?
They're
Generalized.
worrying all the time about school, like on the weekends when you have days off, you're just always thinking about it.
Okay, so it gets to the point where they can't have any fun. They can't do anything fun on the weekend, right? Or so, then it's really excessive, right? It's beyond like the half of you, right? When it occurs all the time and even after the work is done, right? You can't, you know, yeah, like the other day, I think it was last Tuesday, I can't remember. I spent the whole day preparing for classes. And I was still worried about my classes the next, like if I was adequately prepared. Because you could, like, think about being a professor, you could prepare endlessly, right? I mean, I could look for videos that would be cool for hours, right? I mean, right. And if you guys are writing papers, how long could you write them for? It can be rewritten, infinite number of times, right? Yeah, so it can get excessive, right? And so I want to kind of make sure you guys learn how to read the DSM, the Diagnostic and Statistical Manual. So that is on its 5th version. So the DSM-5 have lists of symptoms that they call criteria, the criteria for generalized anxiety disorder. And this helps everyone kind of agree. It's like an operational definition of what this disorder is and how it's different from other disorders and how it's different from just worrying about things sometimes, right? So it's excessive anxiety and worry occurring more days than not for at least 6 months about a number of things. So if you're only worried about school and that's it, then it wouldn't be generalized, right? Generalized means in general, right? And if there's only one thing that you're constantly worrying about, it wouldn't be generalized anxiety disorder. Amanda?
I have a question.
Yes.
So, when it says like more days than not, so like if you're worrying for like 6 days and then like you have one day where you don't worry and then you go back into that worry, does that still like affect being it
That's still
severe?
more days than not. Like
Okay.
if you were worrying for 3 days and then you stopped for 4 days, then you wouldn't be worrying more days than you weren't worrying, right? So if you worry more than half the days, then you're worrying more days than you're not worrying, right? So it's too much worrying if that's what they've decided the cutoff is, and it's hard to do. So what they do is they talk to a bunch of clinicians, they read articles, they look at, uh, the international classification and diagnostic manual. They do all kinds of stuff to figure out what the kind of agreed upon cutoff is. So it's more days than not. I don't know. I don't think it's most of the day. I think it's just more days than not. Um, and then the individual finds it difficult to control the worry. So some people worry and they like think about things as a manner of planning, right? Any planners here? Do we have any planners, right? You got your bullet journals and your sticky notes and your own vastly sophisticated manner of arranging your lives, right? Yeah, some people do that and that they use worry as a motivator, but then they can stop when they want to go have fun. But individuals with GAD can't, you know, They can't turn it off to go to sleep or have fun. And then this is the part that gets weird in the DSM-5. It's when, there'll be like a list of things and the person has to have a certain number of them to be diagnosed. Okay, and that's like a severity thing. One of the problems with it is, look, there are 6 things and somebody has to have 3 of them to be diagnosed with GAD, but 2 people with GAD could have the exact opposite 3 things. So they might look very different, but they have the same disorder. And it also gets kind of confusing for students to try to remember this stuff, right? But I want to try to get you kind of familiar with the DSM as soon as possible. So the anxiety and worry cause like 3 or more of these things. You could have all 6 of them, and that would be a pretty severe generalized anxiety disorder. And in kids, it only has to be 1. Why would that be? Why would kids only have to have 1 of the symptoms? In children.
Is
Like
it
young
because
children.
of like how young they are and they're probably less receptive to being able to like control or calm down easier?
So what was the first part of what you said?
Just their age being younger?
So they're younger, and why would they only need 1 of these things, like being easily fatigued, having muscle tension? Why would kids only need 1 of those to get diagnosed? Somebody said less responsibility, so there's less to worry about, right? But are kids less likely to have these symptoms in general, would you say, Amanda? Oops. I hate when I
Yeah.
like being fatigued.
Yeah.
Do you know a lot of little like 7-year-olds who are like, oh, I don't want to go out to recess. I'm exhausted.
No.
Right? There's not a lot of that, right? Those were the days. Right? Never get tired. They might get restlessness, feeling keyed up or on edge, right? But yeah, without as many life stressors, like Lexi said, yeah, it's concerning if they're having any of these symptoms, right? So restlessness, feeling keyed up or on edge, being easily fatigued, difficulty concentrating or mind going blank, irritability, muscle tension, sleep disturbance. Right? So some people sleep, but they don't feel like they slept when they wake up. And that's because they are asleep, but it's restless sleep. And they don't spend enough time in, I think it's the stage of sleep, the deep sleep. I don't know if that's the dreaming, the REM sleep. That is the most refreshing. I can't remember. But they don't spend enough time in that deep of a sleep. And that's why they don't feel refreshed when they wake up, right? The symptoms cause clinically significant distress or impairment in functioning. So there are a lot of D words when we're deciding whether something is a disorder or not. There's deviance, is it different from the cultural norm? Does it cause distress, right? Does it cause dysfunction? That's what impairment in functioning is, right? So deviance, distress, dysfunction, the duration, right? A lot of D's. Think of the D's. um, and then it's not attributable to the effects of a substance. Can you think of a substance that might make people get anxious? Like a drug that people might use for fun?
Like marijuana,
Marijuana,
alcohol,
right? People sometimes get
sometimes
really,
maybe.
huh?
I said alcohol sometimes maybe too, some
That's
people.
true. Yeah, some people. Different people react really differently to alcohol. Any others that make people keyed up or restless? speed, right? Stimulants, right? Caffeine. People, there is caffeine intoxication is in the DSM-5, believe it or not, and caffeine withdrawal. So yeah, there are substances that could account for this and make somebody look like they have GAD when they actually don't. Okay. And it can't be attributable to a medical condition. So the one that you're going to hear about all the time, like it's in tons, it's at the end of tons of DSM-5 criteria, is hyper and hypothyroidism. So the thyroid is this butterfly-shaped gland right here. And if it's overactive, if it's hyperthyroid, people look anxious and fidgety, and their metabolism speeds up, and they have tremor. And if people have hypothyroidism, they slow down and their metabolism slows down. They're not hungry, but they gain weight. I remember, so I had hyperthyroidism, and I barely have a thyroid now. They ablated it. But I remember that one of the tests that the endocrinologist gave me was like to see if I had tremor. So if you look at my fingers, well, they look a little tremory. But they used to be like, and so if you want to do like a little home test, but go to your doctor if you're actually concerned. But he like put a piece of paper on my hands like this, and it was like, so you can kind of see if you have tremor or not. And tremor is a symptom of hyperthyroidism, and it can look like, a symptom of GAD. It can look like a symptom of bipolar, or, it looks like psychomotor agitation, which is a symptom of a lot of things. So it's a really good idea to have a medical kind of rule out, like blood tests and, a physical exam before you diagnose someone with something like this. All right, so it affects about 3% of the population. I would bet that it affects college students disproportionately, because that's pretty much the case with all of the anxiety disorders. There's been a big spike in it, probably since like 2007, when there was a big crash in the economy. I think most college students have been kind of stressed out since then. That's been my personal experience, and that's when I've seen it kind of in the literature and in the APA monitor, like our field's kind of, journal that tells you what's happening in the field. It is much more prevalent in females. There are twice as many females who have it than males. What does it mean? Its onset is insidious, beginning in early adulthood. What is an insidious onset? First of all, what's onset?
Kind of like a gradual start to like showing symptoms.
Right. So the onset is when does the symptoms, when does it appear? And then insidious means it's gradual. It kind of sneaks up on somebody. And the opposite would be an acute onset, like bam, somebody is all of a sudden totally changed and they have this disorder. So generalized anxiety kind of creeps in around your age. A lot of things kind of creep in around your age. Sorry, not to like make you anxious, but a lot of things have onset right around now. It's very prevalent among the elderly, and it tends to run in families. So anxiety overall tends to run in families. And then, which disorder people have might change, So, one of your parents might have panic disorder, and then you have generalized anxiety disorder, right? But the genetic heritability is for anxiety in general. Um, so the DSM always talks about associated features. And what that means is they've kind of noticed what tends to go along with, oh, somebody has a question. Would GAD be more nature or nurture? What do people think? Do you think it's more, I mean, I've told you that there's definitely a genetic component, but how much of it is how you're raised, do you think?
I feel like it kind of could go both ways. Since you did say it runs in families, I feel like there definitely has to be a genetic predisposition to it.
Yeah.
But also like environmental factors like your work environment, like your relationship environment could also really trigger generalized anxiety.
Yeah. Yeah, so the type of environment you're in, can parenting, do you guys think? Anybody have a parent who's a little triggering in terms of, or know someone who does? You don't have to out your parents or throw them under the bus, but do you know a friend who has a parent with a parenting style that kind of promotes anxiety? Yeah, what kinds of things promote anxiety?
Just like pressure and stuff. Your parents like putting a ton of pressure on you with like grades, like
Yeah.
sports.
Yeah, pressure. we have some greatest hits about my paternal grandmother. She could be kind of brutal. And my brother graduated college, and he hadn't had like the super serious girlfriend yet. And my grandmother was like, how are you going to meet someone if you didn't meet anybody in college? How are you ever going to meet someone and get married? And we were all like, oh my God, like who says that to somebody, right? But like, and he, didn't really, he was fairly popular. He hadn't really thought that he was a big failure, but some people can kind of introduce the idea that maybe there's something to worry about, right? Or if they're constantly worrying about you, something that might not have occurred to you as a problem might suddenly start to occur to you as a problem, right? Parents' personal life experiences of their own anxiety can get passed down to their kids. Yeah, right. You can kind of live in fear of what happened to your parents happening to you because they're so, defended against it. They're so hypervigilant about it, right? Don't make my mistakes, right? That kind of thing. But in terms of, so the DSM talks about things that professionals have noted tends to occur along with having these diagnoses. Okay, so they're kind of correlates. They're things that correlate with having the disorder. And they're not saying that these things cause the disorder, but they're saying, people with this disorder often have this going on too. So people with generalized anxiety disorder have been called autonomic restrictors. So what that means is they don't respond as much to stress with elevated heartbeat, perspiration, respirate, hyperventilating, that kind of dizziness, as other people with anxiety disorders. But that's not because they're not sensitive or reactive. It's because they're so highly sensitive to the possibility of rejection, humiliation, failure, danger, a health problem, that they avoid threat. So as soon as they, get like a little short of breath or feel a tiny bit nauseous or their heart rate goes up, they're like, I can't be in this situation, right? Or I can't allow myself to feel this way. I can't be this uncomfortable. And they get out of the situation that is causing the anxiety. And what does that do? When you avoid situations that cause anxiety, what happens?
Phobia?
Hmm?
It gets worse.
Gets worse. What did somebody else say? Christopher?
I said phobia, but I don't know if that's right.
Yeah, you can, well, you can develop a full-blown phobia and it can turn into agoraphobia. Yeah, it gets worse because exposure is the treatment for all of the disorders. You've heard feel the fear and do it anyway, right? Unfortunately, the thing you least want to do is the thing that works the best with anxiety. It's kind of like, I always think like, it's kind of like physical exercise too, right? Everything that like somebody wants to do the least is usually the thing they want to do, they need to do most. Like, so for me, it's in Pilates when you do those tiny crunches for 6 hours, or a plank for like 3 minutes. I'd rather die, but that's like the thing I'm worst at and the thing I need to do the most, right? So it's the same thing psychologically when it comes to anxiety. The thing that people want to do least is the thing that they need to do the most. Same as depression, like exercise is incompatible with depression, and which means if you actually exercised, you wouldn't be depressed. But people who are depressed can't make themselves exercise, right? I mean, that's part of the disorder, right? So it's super hard. But yeah, if people are so sensitive to threat that they never confront it, it tends to snowball and get worse. Right? Okay, so what's the treatment? Unfortunately, you'd think that since this is like a little bit less like full-blown panic attacks are more acute and feel more like an emergency than generalized anxiety disorder can feel like sometimes. However, panic disorder responds better to treatment than generalized anxiety disorder does. There's a response to treatment in generalized anxiety disorder, but it's not as strong as a lot of the other anxiety disorders. And so CBT works. Oh, what would I do about someone who is working out consistently, but still feeling that same anxiety and or depression? Um, I'd probably refer them and see if they needed medication. I'd see, unless, there might be some huge, obvious environmental thing going on. That's always a possibility. If there's someone like oppressive or like verbally abusive, or if, like say they're in school and they don't want to do that, right? Like if you look at like the causes for suicidality, some of the most common causes for suicidality are like being transgender and not being out, being gay and not being out. There are some like being mixed race and not being accepted for it. And so like I'd probably try to find out if there was, I wouldn't like ask them, are you mixed? You know what I mean? But I would try to figure out if there was some obvious thing that was making them depressed and work on that. And I'd also have a big workup to see if they needed medication too. you know. Somebody asked me what I'd do if someone was working out consistently and was still depressed. So that's what I would do. Hopefully that answered the question. All right, so it has generally weak effects, but you're going to notice a few things that happen over and over again in here. In general, the psychological intervention that is found most effective for almost every single disorder in here is going to be cognitive behavioral therapy. And that's the kind of therapy where somebody identifies their automatic thoughts that they tell themselves over and over again that are kind of faulty and not doing anybody any good. And they try to do something else than tell themselves that thing. Like, how are you ever going to meet anybody if you didn't meet somebody during college? You know, that's probably not the ideal thing for somebody to tell themselves, right? And then pharmacotherapy, that means medication. Some people prescribe benzodiazepines like Xanax, Klonopin. Those are highly addictive. They tend to have like a quick, well, at least Xanax is like a really quick action and then it kind of goes away quickly. So it doesn't really help with like long-term generalized anxiety. The SSRIs are, okay for generalized anxiety disorder, but not as effective as they are for like depression and other forms of anxiety. Meditation has been found to be as effective as anything else, CBT and or medication or a combination. And that's mindfulness meditation, which we're going to do a 3-minute meditation, I hope, right at the end of this. Okay. In terms of treatments, it's a good idea to start talk therapy first. People do better if they start talk therapy first, because otherwise they tend to think the only thing that's improving anything is the medication. So they tend to lose a sense of self-efficacy around that. Could it be more harmful to give a patient such heavy medications if it does not provide the needed long-term effects or have a strong impact? Yeah, that's exactly what I'm saying. And sometimes benzodiazepines have a really quick, strong impact, but then it goes away quickly, like even within, an hour, and then the person just wants more. And then also people develop a tolerance, so it doesn't keep working over time. So yeah.
The doctors usually on like a lower dosage for that then?
Mm-hmm. Yeah, I mean, it's much safer to do a lower dose of that. People prescribe it. People prescribe benzodiazepines a lot, like right after a loved one dies, after a horrible accident, after a traumatic event, that kind of thing. And some people prescribe them for like night terrors and, like in low doses for longer periods of time. And if somebody develops a tolerance quickly, then it's more of an issue. Right? Okay. All right, so I want to do a really quick meditation with you guys. It's a headspace one. My son was having some anxiety and having trouble sleeping, so I got him headspace. Wait, this reminded me that we haven't been using it lately. But let's just do a little 3-minute meditation together, okay?
So just
Oh.
taking a moment, just getting comfortable, back straight, the eyes open, soft focus with the eyes. And just starting with a big deep breath, breathing in through the nose and out through the mouth. As you close the eyes, as you breathe out, just letting go that feeling of stress, of tension. Doesn't mean that the mind would immediately stop thinking about it. Just allow the mind to do its own thing as you just pause, feeling the weight of the body, contact with the surface beneath you. Noticing how the body's breathing. And now you just place your hand on your stomach or your chest if you can't feel that movement. And just letting the mind do its own thing for a moment.
Oops.
Just gently focusing on that movement of breath. And of course, the mind is going to wander off, wants your attention right now. The moment you realize you got caught up in thinking, just gently noting it in the mind. Oh yeah, it's thinking. And coming back to the breath again. Doesn't matter what the situation is. For this moment, just gently label it. Thinking, let it go. And come back to the breath again. Again, notice the distraction. Label it. Oh yeah, thinking. And come back to the breath again. Giving the mind plenty of space. Allowing those thoughts to play out. Gently bringing the attention back to the body. Back to the space around you. And gently opening your eyes when you're ready.
Okay, so that's mindfulness meditation. That's Headspace, which I pay for just because I really like it, because it has like cartoons that tell you what to do. And it was for my 13-year-old son. And you don't have to try. Like it just tells you exactly what to do. And you don't, like, sometimes I have to kind of try to meditate. But with this, you don't have to. You just watch the screen and it kind of happens. But there's lots of free ones online, and it's free. There's no side effects. You don't have to go anywhere, and you can do like as few as 3 minutes, like 4 times a week, and it reduces anxiety and depression, and it reduces performance anxiety on exams, and it enhances performance on exams. So whenever I say this, I'm like, why don't I do this more? But yeah, so that's why I did a little short one with you guys today. Okay, so we will stop there, and I'll see you guys on Wednesday.
Thank you.
All right, thanks.
Thank you.
Thank you.
Thank
Thanks.
you.